All right, so it's somewhat honored to have Doctor. All right, is here and to do a more in-depth sharing, especially I would just want to invite for those who have been I wouldn't want to say it so clear, but you have been aging a little bit, like maybe 40s, 50. Because why? Most of the eye diseases, if I'm not mistaken, sorry, I'm not a doctor, okay, but most of the eye diseases actually happens after the age of 40s, right? So yeah, every one of you, if you all encountered any problem or you started to have like a dry eye issue, or you started to not seeing things clearly, or you have any symptoms, okay, you may sit down here because we have the doctor here, and he's going to answer the questions for you, all right?
Sure. Okay. So I will start my talk, okay?
All right.
So disease of the aging eye. Anything probably more than 50 now.
50, all right.
Okay, anyway. These are the content. The first one will be about cataract. Then there's diabetic retinopathy and diabetic macular edema. Anything to do with diabetes.
All right. Oh.
Age-related macular degeneration, glaucoma, and some common myths.
Oh, okay.
Okay.
Sorry, doctor. Before we carry on, okay? Can you please give doctor a big round of applause? Thank you so much for coming down here. Because I want you to break the ice here. I think there's like a war between the audience, and I think Dr. Chen is a bit shy. So one more time, let's give Dr. Chen a big round of applause. Thank you so much for coming down at this wonderful Sunday afternoon. It's definitely our honor to have you. All right, so Dr. Chen, let's carry on.
Dr. Chan is not really that shy, but let's go on. So inside our eye, there's actually a lens. In a normal lens, it's actually clear. So light will actually pass through easily. But when you age, the lens will become a bit whitish. So light can't really pass through. It gets dispersed. So this is what we call cataract.
Mm-hmm.
Yeah. So you will get this maybe after 40s, about 50s usually.
But it's not everyone, right? But higher chances.
Almost everyone.
Almost everyone.
Yeah.
Anyway, cataract is actually called 白内障.
Yeah. Ngan mok or 白内障. Alright, anyway. This is a common question that's asked. When should you do your cataract surgery? The answer now is actually when it affects your lifestyle. Last time, maybe about 30 years ago, it's more like, oh, when it's very mature, you can't see, you go and do it. But nowadays, when it affects your lifestyle, we already start doing it. So for example, for a CEO of a company, so, everything is fast going, so we do it early.
Mm-hmm.
Someone who is actually not doing much at home, maybe just watch TV, cooking, you may want to do it later. So it really depends.
Okay.
All right?
Can I ask a question? Is surgery the only way to cure the disease?
Yeah. Unfortunately, surgery is the only way now.
Supplement doesn't help anymore, isn't it?
There is actually no supplement that actually proves that it helps, or there's no medication to reverse it.
I see.
Okay?
All right.
So how is the cataract surgery actually done? Now, it's actually through a small little incision. We break the lens with this instrument. It's just like a pencil. I don't know whether you can see it. It's like a pencil thing through this machine. And it's something like a jackhammer right there.
Mm-hmm.
We break the lens,
Oh.
and then we actually suck it out and put in a new lens. So this is something like a lens replacement.
Oh, I see.
Okay? So the common thing is that these are the common question that is asked. We usually do it under local anesthesia, meaning we just put an eye drop. There's no bleeding, you're aware of the surrounding. Sometimes we can do under sedation, meaning we give you some medication to... It's not really sleeping, it's just a bit, I don't really care what you're doing to me. And also general anesthesia, meaning you're sleeping. But most of the time, 99% of the time, it's just local anesthesia. The duration of the surgery, the whole surgery is 5 to 10 minutes only. And it's a painless surgery, or it's more of a discomfort. You feel some pressure in your eye. So let's say from 0 to 10, 0 is no pain, 10 is very, very pain. It's about 0 to 2 only.
Oh, okay.
Yeah. So, like I said, it's bloodless. You don't really need to stop your medication. Whatever you're taking, you continue taking. It's a sutureless or stitchless surgery. We don't really put a stitch there. Now, one thing important that it's not really a laser. It's called phacoemulsification. It's a type of ultrasound.
Ah, I
Yeah?
see.
So, but there's a lot of things that we call bladeless surgery nowadays. Well, we do have that. It's called femtosecond laser-assisted cataract surgery. And what we do is really just to make a small little incision on the cornea and then a small little incision on the lens. This will actually take about maybe 10 seconds for me to do this. Instead of using a machine, I need about 10 minutes to do it. So, but the difference is the standard one is actually faster and it's actually it's cheaper to do the standard one. And this laser one actually causes our eye pressure to be high, so people with glaucoma can't really do it. But the final results is actually the same. Yeah, so actually there's not really a better thing to do with the laser assisted ones. You pay me more though.
Does it? But yeah, true. Because with the machine, right? But
Anyway.
does it has like what do you call it? The risk of like any risk behind the surgery?
Actually, if you are well trained, the surgery is actually very safe.
It's very safe. Okay.
Yeah, this is the safest surgery in the world.
Oh, okay.
Yeah. Anyway, what happens during cataract surgery? As in when you are doing it, you will be lying down on the bed. You will see a very bright light. All you have to do is just look at the light. Don't blink. Yeah, this is how it looks like. And the doctor will just talk to you, and the nurse will talk to you. You hear some machine sound. Zzz, 5 minutes. That.
Really?
Like I said, yep.
It doesn't sound like surgery.
Yeah, this is how it looks like.
Okay.
Yeah.
All right.
And like I said, usually there's no pain after the surgery, and you just feel a bit of gritty sensation in the eye, some mild discomfort, and some blurry or wavy vision for the first day or 2 days, something like that.
Okay.
Yeah. So we don't keep the patient in the ward, same day, go back. Half a day probably.
Oh.
So there are a lot of lens that we can put into your eye, but I need you to understand certain things first. Something called near vision. See, near vision is like how you look at your phone, reading. Intermediate vision is something like me and you now, or maybe looking at computer, cooking. These are intermediate vision. And far vision, which means you look far away. I want you to understand the concept first.
Okay.
So, anyway. So the first type of lens is called monofocal lens. So this lens is only for far. When we put into your eye, it's only for far. So anything intermediate and near, you have to wear glasses. Low far, you still have that, right? You just need a reading glass. So, but at night, you don't see anything different. It's very clear. Okay, now I go on. Something called EDOF lens, or extended depth of focus. Now this is actually it's a type of multifocal lens. You can see far, you can see intermediate, but not near. So the near one, you need to wear reading glass. At night, clear.
老花眼镜 reading glass.
Yeah. Next one is called trifocal. So this is actually usually the most expensive lens. You can see everything, far, near, intermediate, no need glass now. It's something like even an 80-year-old man can go back to a younger age. You don't need to wear glasses anymore. But there's a side effect where you see some glare and halos at night. This is only when you drive at night. But 3 to 6 months later, it will actually be reduced. You will sort of adapt to it. Okay? This is just what I mentioned. So the distant vision of all the lens is actually quite good, except for the trifocal one. It's actually slightly, it's not that sharp, but you can see. So the intermediate vision, like I said, the EDOF and the trifocal is actually pretty good. But the near vision, only the trifocal you can see.
I see.
And you can see that at night, only the last one actually has that problem of glare and halos. But the first two, you don't really have that. Okay. The next topic now.
All right.
This is about diabetic retinopathy. Diabetes, Tim Liu Bang.
糖尿病 diabetes.
So, what happened is it's a major public problem. Actually, no one really knows about it. No one really talks about it. That's why I'm here to talk about it.
Oh, because we didn't know that diabetes can really cause any eye diseases.
That's the whole point. So anyway, in Malaysia, about 15,000 to 39,000 lose their sight per year.
But
Per year, yeah.
oh wow,
Yeah.
okay.
So in the early stage, actually there's no symptoms, but and the patients are not aware of their changes and all. So that's why we need to do screening. That's why we have all these screening things here, right? So anyway. So like I said, early stage is no symptoms, and in Malaysia itself, now this is actually a study done. You know, most of us that we've diabetes, we check our blood pressure, the kidneys, the cholesterol, the urine, food, ECG. You check everything, but you don't check your eye. Only 48% of people actually check their eyes. And even after 6 years, we give public talks. No one actually listened to it. And we are still at 50%. Yeah. So the symptoms of diabetic is actually blurring of vision, and you see floaters. These are all already too late, and patchy visions, which means it's actually bleeding in the eye already. And the eye may be pain, and also you get a bit of wavy vision.
We cannot do anything to reverse back the symptoms.
There are certain ones that you can, there are certain things that you cannot. For example, a tree, you will see that it's actually crooked.
Okay.
So these are the things that you actually see. And how does actually this diabetic happen is that, okay, if let's say you're normal, blood supply goes into your eye normally. But when you have diabetes, that actually reduce blood flow, which means your blood vessel from 10, let's say, it reduced to 4. So you don't have enough oxygen and food. That's why the new vessel starts to form. And these blood vessels actually will burst easily. And it will become like bleeding inside the eye.
Okay.
So you want to avoid that. That's why you need to screen your eye here.
I see.
So these are the different signs of the eye where there's bleeding inside the eye, and you don't want to have this when you have diabetes. Yeah.
I see.
Okay, I go on.
It looks very
It's
terrible.
scary, terrible.
Yes.
So these are actually some oil inside the eye, and that's some dead.
Okay.
Yeah.
So what is there any cure? Surgery? No way. There's no way to reverse back, or there's no way to cure it.
We will come to that in a while.
All right.
Anyway, these are the different things that happens. Anyway, you need to actually screen your eye when you have diabetes. Let's say there are two types of diabetes, type 1 and type 2. The type 1, which means it's usually the younger age. Once you have it, you should start screening it already anyway. If you are actually during your pregnancy, you have diabetes, also you need to see your eyes for that. And for children as well, actually children get diabetes as well, you need to screen your eye as early as 10 years old.
Okay.
Yeah. So I go on. I think I should skip this. These are all what we can do to actually prevent diabetic retinopathy. Actually giving talk like this is one of it.
Alright.
Dietary lifestyle modifications. Yeah. And we actually have fundus camera where actually we take pictures of the eye, just like what we have here. Is actually to screen your eyes whether they have any diabetic changes or not. And it's actually widely used now with AI technology where it's actually, once we take the picture, it will be automated and it will tell you whether you have diabetic retinopathy or not.
Oh, really?
Yeah, so
Okay.
this is how it works. Let's say you have your machine here, you take the picture, and it will be sent to a cloud. And this cloud, through AI,
Okay.
will tell you whether you have this problem, whether you should see your doctor or you are fine. So from there, you will tell the patient, so you don't even need to see the doctor nowadays.
I see.
Now this is a sample of it. So after taking the picture, they will tell you whether this is type 1 and then what kind of severity is it, whether you need to see a doctor. In Malaysia as well, we actually have that already.
Oh, I
Yeah.
see.
I think Focus Point has this machine as well.
Yeah, they
Yeah.
have that machine.
Yeah.
Yes.
So anyway, like you say just now, the treatment is actually, it's called intravitreal injection. It's actually an injection into the eye. Yeah. It's not really painful. I would say that your vaccine that you took was actually more painful than the
Really?
injection. Yes.
Because the eye doesn't have a nerve, isn't it? So you don't feel any
No,
pain
actually we
also.
put some painkiller in, you
That's-
don't really feel anything.
I see.
Yeah. All you feel is just some water going to your eye, that's it.
Okay. A bit gross, but yeah. But it's still better than the pain.
Yeah,
Yes.
of course. But anyway, the next one is called laser photocoagulation, where if there's bleeding in the eye, this is what you should do. And there are more treatments to come anyway. There are oral medications as well to sort of reduce it, but you mentioned just now. But it's just for those early stage, it's not for those with late stage. So the next thing is called diabetic macular edema. This is actually part of the disease of diabetes as well, but it's got some swelling in the center of the eye. This will cause some blurring of vision. And this goes hand in hand with the diabetic retinopathy, the bleeding just now. And what happens is your vision just like, is a bit wavy, and this center vision is gone. So the risk factor is if your diabetes has been long, let's say you have been having it for 10 years, even though it's very well controlled, you may have a risk.
Mm-hmm.
Okay, hypertension is another one. Hyperlipidemia means your cholesterol is high.
Okay.
Poor kidney functions. And actually your blood sugar control, you don't care, you take all this kind of food. These are all the
Actually,
risk.
all these things actually goes back to your lifestyle, right?
Yeah.
Whether you want to keep it healthy,
Correct.
you don't consume so much high cholesterol food or high oily food, or it's actually, we can prevent that as well, right?
Yep.
Yes.
So the treatment, like I said just now, is to control all your hypertension, all your risk. And of course the injection just now, and actually we also inject steroids in the eye, and also surgery as well.
But because I heard that steroid cannot go to the eyes, right? Is it?
Yeah, but these are certain conditions that we actually use it.
Oh, okay.
Yeah. So next thing is called age-related macular degeneration, or ARMD. Now this is actually something that probably people don't really know about, but it is actually a reversible thing that actually happened to people about 60 years old and above. And there's actually two types. It's called dry ARMD and wet ARMD. Usually 60 years old, people with smokers, and you have genetic of it. The symptoms is blurring of vision again, but it's all in the center as well.
Mm-hmm.
So anyway, the dry one is something that happens slowly. So let's say about 60, you start to be blur, slowly blur. But the problem is, this is actually not really a reversible condition. Yeah.
So do we take off the entire eyes, or
you don't take it off, but it's like a non-functioning eye. Whatever you see, the center is gone.
I see.
Yeah. So the wet one is actually a rapid thing. It's suddenly you just lose your vision. But this is actually a treatable condition now. After certain medication, you can actually be reversed.
I see.
Yeah. So again, it's actually the same thing. It's actually intro injection that we do. And there are certain things that can be done as well, such as stop smoking. You can take some supplements for this. This is the only one that we ask you to take supplements. It's called AREDS 2. You can get it off the pharmacy anyway.
Okay.
And of course, take more green leafy vegetables. And I think, that's all.
Doctor, can I ask the questions? Because we
Yeah.
always heard about, I'm not sure whether is it like a myth that say blueberries help for your eye health.
It's a myth, I think. We don't really say that, you take blueberry can stop anything. Not really.
Then all the blueberry supplements that can help eyes, is that myth? Is not scientific proven, or is it scientific proven?
I would say it's a scientifically not proven thing.
Not proven thing.
Yeah.
I see.
Okay, next is about glaucoma, 青光眼.
Mm-hmm.
So it's a group of disease that cause the optic nerve. It's a nerve inside your eye to be damaged, and it's called a silent thief of sight, where you actually lose your vision over a period of time, but you don't even know it. So it can happen in any age, but usually about 60 years and above. But it can actually be younger as well, but it's more common above 60.
It's all based on your lifestyle, isn't it?
No, this is more of a genetic thing.
For genetic thing,
Yeah.
I see.
So I'll just explain what is 青光眼. It's not at night your eye glow. It's actually in a normal eye, there's actually water going through in and out of the eye. So if there's too much water going in, too little water that comes out, the eye pressure will actually be increased. So when it increases, as you can see there, it will actually compress on your nerve at the back of your eye. Yeah? So when it compresses on the back of your nerve, it will change from like that to a bigger one.
The water means tears, right? The
Sorry?
tears.
No, it's
the-
not
the
tears.
tears,
This is inside the eye.
It's
Yeah,
okay.
so inside your eye, there's actually a circulation where it gives you some food into your eye and oxygen into your eye. So this circulation is needed.
I see.
Yeah. I'll go on. So this is the nerve that is actually abnormal. So what we actually do a screening over there, is actually to see you see this is a normal optic. It looks like that. So you gotta have an imaginary thing that there's actually a line here and outside. So this is actually a bigger one. Look at it.
Yeah,
Yeah.
true. Yeah.
So that is the advanced one. So what do you have in glaucoma is that normally when you see things, everything is clear. But with glaucoma, it starts from the side. You will not be having some vision at the side. It starts to be blurry, 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 and finally you just have your center vision left. Okay. This is a very slow progress, but by the time you know it, it's already sort of too late. So this is actually a test that we do to actually see whether you have glaucoma or not. Is to see actually your visual field, whether or not your vision at the side is actually okay or not.
Where do we get this? Can we get at the
No,
exam?
I don't think so. They have it here, but you have to see an eye doctor for that.
I see.
Yeah.
All right.
So actually glaucoma, there are two types. There's open angle and a closed angle type, so this is an open angle thing where actually there's a opening still. The water still goes on very well. But the other one is a natural born thing where your lens is actually shifted to the front and you could have a sudden attack. So the difference is this open angle glaucoma is a slow progression thing and it's over a long period of time. And once you know it, it's already too late. This is more common actually and it's irreversible. It's
so
more of
sad.
Yeah.
So there's no treatment at all right now.
That's treatment, but it's not reversible. As in, it's something like you have hypertension. We can give you hypertension.
To control it.
Control it, but we can't reverse it.
All right.
The close angle glaucoma is a sudden thing. Now, this is one of the medical emergency. It's a rare thing, but once it comes, you suddenly cannot see, and you may come with headache, vomiting, and your eyes are pain and red. But this is actually quite rare. But this actually sometimes can be reversible. Yeah. And it's actually quite common in Asian as well. And you have a shorter eye if you're born with it. So, but this open one is more for a longer eye. Myopia, if you have Kansi, actually this is a risk for it. Right? The treatment of glaucoma, like I said, is it cannot be reversed, but you need a regular checkup. We will give you some eye drop actually. There are different treatment. There are lasers. You can do it's something like a minimal invasive surgery. Yeah. And there's actually a bigger surgeries as well. So these are all just to control the glaucoma. So the angle closure glaucoma is a medical emergency. Like I said, these are rare. This is one of it. The eye pressure will be very high. And we need to remove the lens to do a cataract surgery as soon as possible. You can also do a laser for that. Now, some of the myths of cataract, this is what we always get asked. So, does young people get cataract? Yes,
Really?
They do, yeah.
Okay.
The youngest I have done is actually a 3-month-old baby. But, for example, years ago, about maybe 10 years ago, I probably see about 1 or 2 young cataract in 1 year. But nowadays, I see about 2 to 3 in 1 month.
But what causes it? I mean, like
these are the causes actually. It could be due to injury, some form of disease, like let's say diabetes, some autoimmune disease.
But is there chances for the baby to get a diabetes?
It is.
Really?
There is a chance, yeah. So you have to see whether... Also, there's radiation. I don't know what... Some people work with radiations. Drug reactions, as in... certain medication that you take, such as steroid as well. The congenital condition is when you're born with it. Yeah, and some lifestyle, such as excessive smoking and too much alcohol, and if you've done some other surgeries before.
I see.
So, this another one is like, must my cataract be fully mature before I actually do it? The answer is no. Like I said, it's more of a lifestyle thing nowadays. If let's say you feel that it's a bit blur already and you have a little bit of cataract, we don't wait until it's mature. Actually, doing it mature is actually a bit more risky nowadays because it's less accurate and the surgery will take a longer time and it's also take a longer time for you to recover.
I see.
Yeah.
But because from what doctor have been shared, I think the surgery is quite mature nowadays, right? Because we were saying just like a few minutes
like
of the
I said,
surgery.
it's just a 5 to 10 minute surgery.
So it's considered quite a mature surgery, right?
Yeah. Yep, it's a very mature surgery. This surgery has been there for like almost 60 years or so.
Oh, okay.
Yeah. Okay.
All right, guys. So if you guys have that problem, remember to go for doctors and see, and do not avoid the surgery. Yes.
Now, next thing is myths of glaucoma. 請講緊 surgery can cure glaucoma? Not really. It only controls it. And if let's say no one in the family has glaucoma, I won't get it. That is actually wrong. You may actually still get it. And a person with glaucoma will eventually be blind.
Yes, right.
Not really. In
But
certain
you see it's a small
it
part.
depends on how fast you progress and whether or not you actually take your medication or not. These are the certain things. If you don't, of course, you'll be blind. Anyway, testing for glaucoma is painful. It's wrong. The testing of glaucoma is really just something like taking a picture only. Yeah? And glaucoma is only found in elderly. No. Actually, younger ones can get it as well. Even baby can get it congenital, meaning you're born with it as well. Anyway, spending too much time on a computer with glaucoma, not really, because it's dry eyes and what you mentioned just now,
Yeah.
myopia and all those. And glaucoma frequently cause eye pain. Like I said, it's a silent thief. You don't really know it until they take it away from you. And if you have good 6/6 vision, doesn't mean that you have no glaucoma. No, actually, like I said, it's a center is still preserved until the end. So you feel a bit dim and all those. You probably don't know it until it's too late. So in a way that you're just screened for it. Especially when your family history, your mom and dad has it, you better go and check for it.
All right.
Okay? This is one of the very interesting thing.
All right.
Now, we actually get a lot of all this nowadays. Like some tea, some medication, or some special spectacles that can help you with your, I don't know, cataract or your age-related macular degeneration, whatever. These are all fake.
But to be
No.
honest, I've been seeing like some of the, especially on Facebook, they
Correct.
have like products is like telling they can cure
Yeah.
glaucoma and they can cure
Yeah.
all the diseases.
So this is my own picture in a society,
Uh-huh.
Malaysian Society of Ophthalmology. We are part of it. My picture is actually here as well.
Mhm.
And they use it to sell tea. You see? These
Oh
are all
God.
fake.
Okay.
Please don't buy it. Please don't use it.
But
Yeah.
just want to do one more clarification, okay,
Yeah.
doctor. So we don't really have any scientific proof for any products in the market right now that can cure any diseases. Or is that
Correct.
right? Correct. Is it correct?
Correct.
All right. All right.
Do you want to get all this, get it from, maybe see a doctor rather than buy it online? Isn't it
And
a
it's
bit-
not cheap, to be honest.
Yes.
Things are not online.
I
yeah.
think seeing me is actually cheaper than buying the medication itself.
Please don't. As one is a real service, the other one is a lie. Yes, you cannot compare with that. You cannot compare with that.
Thank
yes.
you. The thing is, it's sometimes very dangerous to you as well, because once you actually think that all this can help you, and you continue to take it, and you have a disease that you think that it can actually cure you,
Mm-hmm.
it may actually be more harmful to you.
Especially for daddy mummies, do not tend to easily get something from online. Consult doctor before you get it. Yes.
Thank you. This is something that I really want to get it out.
I tell my parents all the time as well.
Okay, this is an app that I actually made
Okay.
to screen your eye. I think this is the last slide. You can actually get it on Apple Store, Google Play. You can scan it and get it. And this is actually a web version. If you're using your Huawei, because you don't have those, you can actually use it. So I'm going to play a video. This is how to actually use the app.
Okay.
What it does is actually to screen your eye, whether or not your vision is actually poor. Or if you have problem, then you should see a doctor.
All right.
Right. So I'm just going to play it. I
Yeah,
hope
sure.
there's sound.
Yeah, I think there's a sound.
Okay.
Hi, I'm Dr. Chan Jambon, consultant ophthalmologist from International Specialist Eye Center, ISAC KL. I'm here to introduce a very convenient and simple app that I've created for vision screening, the Rapid Eye Screening Test, or RAS app. RAS is an innovative digital eye screening app that is fast, fun, and as accurate as the gold standard eye chart, which is called the ETDRS chart or Snellen chart. Traditionally, we use the standard charts to do mass eye screening at noisy areas, and this can be challenging to us. The patient needs to see the letters and shout out loud, and the tester needs to listen to what the patient says. Not everyone owns a Snellen chart, and it can be time-consuming and challenging, especially for areas that is noisy and packed. This app is easy to use and can be used by the young and the elderly. You can download this app from Google Play Store or the Apple Store, or even available for the web version for phones that does not come with Google Play or App Store. How to download and set up the application. Firstly, download the RES or Rapid Eye Screening Test application on the Google Play Store or Apple Store, depending on your devices. Take note that the application is more suitable to be used on portable devices like smartphones or tablets. Launch the application and perform a quick calibration by tapping on the Setting tab. Then use the slider to ensure that the letter E on screen has a length of 4 centimeters using a ruler. How to conduct the test. Before conducting the eye test, ensure that the device brightness and sound level is set to the maximum level. Depending on the subject's surrounding space, the subject being tested can be opted to position themselves at a distance of 1 meter or 3 meters apart from the device. The subject is required to cover one eye and indicate the orientation of the letter E by directing their fingers. Another individual will be responsible to hold the phone and swipe the screen according to the subject's gesture. Subjects who succeed the test will be notified with a perfect 6-6 score and a positive sound. Subjects who fail the test will be notified with an uneven score and a negative sound. For the web version, just click on the link below and you will be directed to a page on your browser. Just click on the top left tab and click on the Install app. Do not miss out on the Rapid Eye Screening Test app that is very convenient to you. You can now download it for free on Google Play Store and Apple Store. Or you can also download the web version on the link below. Eye care, no matter where.
Done.
Oh, that sounds interesting. And I think this would be how, people try to develop the habit, to do their eye tests.
Yeah,
It's-
actually, this one you can even do it at home,
Mhm.
and you can actually screen your parents as well.
Mhm.
If let's say this was actually during the COVID time where I sent this to a friend and they would just screen it. Hey, my kids cannot see. That's how we
Oh,
do it. Yeah.
All right. It's I would say it's a very helpful app, especially I know because like when we want to do an eye screening or eye test, right? It's like we have to make a lot of effort.
Yeah.
Driving, get out from the house is a big effort. Driving is a big effort, and then you have to go for any optical store or like clinics to do that. But I think this would be help and they build the habits. Like we have the regulation for doing the test, right?
So we actually have a charity program that we actually do. It's
Mhm.
called Rainbow Bridge as well with Isaac as well. What we do is actually it's a free screening where actually I go and teach the teachers in a school. So the teacher who actually screen all their kids
Mhm.
and the kids with problems, we actually send them to optical shop to actually we actually give them free spectacles as well. Yeah, these are charity programs that we have.
Dr. Chan,
Yeah.
do you heard my story on the previous section?
Yeah, I
yeah,
know.
yeah. It's a very sad. If you all haven't known it, okay, just want to tell you, I have a short-sighted. 就是我近视，在1年级的时候，我是在6年级才发现到我是近视。I think that's one of the I think not so pleasant experience because we don't know how to tell our mom. To be honest, we don't know how to tell, and we don't know how to explain. Like we just know that we cannot see things clearly. 我看不到. But they do not know the terms like it's like 你是怎样看不到. They did not know that. But I think we need to raise more awareness about this, to help out. I wouldn't want, kids nowadays could become the next me. That's a problem, I think this would be really helpful. It's really give an impact to the society. I really loved it very much. When I was seeing that, I was like, it just bring me back to the times like, hey, I hope I have that.
Yeah.
So I can tell my mom, come and do a test for me.
You can try it
Yeah.
at home.
Yeah, true. Yeah. Thank you so much, doctor.
No problem.
I would say it's really, really sad, when you're sharing all the diseases, it's like we gradually we will lost connection to the world. But it is the fact, it is the truth that we have to face it, all right?
Yep.
Yeah, so diseases is actually for, like what doctor said, it's actually everyone. It's not particularly to one group or the other person or one gene, but it's actually everyone. Everyone, eventually, you're going to face that. So prevention is always the cure, I would say, right?
Yeah.
All right.
Okay.
Thank you, Doctor.
Thank you.
Thank you so much. We had a great time with you. Can we
Thank
please
you.
give Dr. Chen a big round of applause? Thank you so much. We really learned lots of things today. Yeah.
Thank you.
Thank you so much.